Away from all that, moving on now, after Mirror now reported that top public and private hospitals in the city of Mumbai and Delhi are under the scanner for overcharging heart patients for angioplasties, including Fortis Hospital in Delhi and KEM and Lilavati in the city of Mumbai. KM Hospital in the city has sent us a response. According to the hospital, they told Mirror now, and I quote, "We have checked and stent prices charged are below the limit. We have given the letter to the NPPA accordingly." Now, the hospital has, in its letter that you see on your screens, sent the invoice and details of the patient who underwent this procedure. We are yet to receive responses from the other two hospitals. Remember, this comes after the NPPA, which is the regulatory body, it's also called National Pharmaceutical Pricing Authority, slashed prices of cardiac stents to bring cardiac procedures within the reach of the common man, which means none of the hospitals can charge you over 30,000 rupees for coronary stents. In fact, we have Malini Aisola of All India Drug Network joining us with some view on the story. Malini, you've been tracking this story from the beginning, even before we saw the price cut. Does this come as a surprise to you that despite all of this that has happened, hospitals are still overcharging patients?
So even though the prices of stents have been brought down considerably, there is a concern that the full benefit of the price control is not going to the patient. So as you mentioned, the NPPA is investigating hospitals that are allegedly flouting this price cap. However, we are also concerned that there is no monitoring of the costs of the cardiac procedures themselves. So hospitals could well be increasing the costs of various other components of angioplasties or diverting patients towards unnecessary procedures to compensate for their loss in income. And so we have been, advocating for the Ministry of Health to undertake an investigation of the hospital charges before and after the price cap. Additionally, we also want for standard treatment guidelines to be put in place for all cardiac interventions, a system of medical audits, and also regulating the hospital rates of various procedures.
Malini, very quickly tell us this. Now, after this regulation that has happened, do you think going forward the number of cases will only come down? Because right now 40 hospitals are under the NPPA scanner.
The number of instances of overcharging, is that what you're asking me about?
Very quickly, Malini, if you can tell me, going forward, do you think the number of cases of hospitals overcharging patients will only come down?
Yes, I think so. I think because the government and the NPPA has been very responsive to patient complaints. And they are taking closely monitoring the situation regarding the pricing of stents and taking action on every complaint that has been received. So I would surely hope that the number of complaints goes down now.
We'll keep a very, very close watch on this story for you. Thank you, Malini, for getting us that view.